Awesome. Good morning, everybody. How are you? Good. Well, we're recording this session, and we're going to see how that works out for anybody who joins us. You guys who are online now, I want you to feel free to use the chat. So I'm going to leave that window up. It's just going to continue to roll and scroll so that if there's some technical issues with volume and stuff, you can do that. But if things are occurring to you, feel free to chat that too. That's great. My name is Beth Meyerson. I'm on the faculty at IU School of Public Health with Bill and others. And I teach public health administration type courses. So my particular course will be this spring in politics and policy, which I hope you will consider taking. It's a really great walk down the political arena and how to work in it. So I look forward to getting to know you all better. I did get a sense of you and your thoughts about wellness through your pictures. And I was really appreciating that many of you had posted by the time that I had seen everything. And so what we're going to do today is talk about public health. You already know the definition if you've been reading. I'll likely share it while I'm here, but that is not the purpose of this session. Instead, I want you to envision what public health might be. And I want you to consider your place in public health. But first, I want you to imagine. I want you to sit back and imagine. Imagine a world now where our focus is wellness, where we might not be focused as much on medical treatment or sicknesses or symptoms, but instead that kind of thing, medical access and treatment, is part of a much larger public health enterprise or a wellness enterprise. What I want you to be thinking about is, what would it be like? Could you imagine a society where what we do together collectively actually assures the condition in which people can be healthy? And if you've been reading, you'll know that that's actually the definition of public health. What we as a society collectively do to assure the conditions that will result in health and wellness. So imagine a society like that. Imagine a world where wellness extends really beyond the physical, though it's part of that, and includes sexual wellness, mental wellness, spiritual wellness, social wellness. That gets to the vision here of wellness. And that's not a new vision, by the way. In 1948, the World Health Organization essentially defined health as complete physical, mental, and social well-being. And so what I want you to understand and to think about and to imagine is a world where our public policies actually facilitate empowerment and self-determination, not for corporations, but for individuals and for communities and for populations. Just imagine that world for a minute. Imagine a world where place, where one is and where one can be, doesn't actually determine a person or their community's health or opportunities. Imagine a world where we're prepared. We're actually prepared to respond together to things like Ebola or hurricanes or mudslides or campus rape. Think about a world like that. Can you imagine a world like that? And so I want you, as you think about this, as you imagine this world, I want you to consider, is this our world today? Is that the world we live in today? I would say Clint Smith will tell us about that world, and I'm going to pop this up for you, and I'm going to force the view of the video so that you can see.
As a child, my father would tell me stories of ancient Egyptian warriors traveling for endless days and nights across infinite desert plains, showing signs of endurance and bravery I could only dream of emulating. He would tell me that upon their return home, these warriors would be welcomed with a feast worthy of their bravery on the battlefield. Years later, as a teacher in Greater Washington, D.C., I too now find myself traversing a desert, though it is not the one I envisioned. A food desert. It's categorized as a poor urban area where residents cannot afford or are not given access to healthy foods and grocery stores. Every day at 2:45, I watch my students hop onto this leaking submarine of a school bus, every block bringing them deeper into an ocean where the only fish they find are fried, where fruits and vegetables just can't be found because there are no grocery stores here. Just liquor stores and Popeyes, Dunkin' Donuts and 7-Eleven's. Children born into a neighborhood that feels more pollution than solution. It is then I realize that I am not too far from the deserts I once dreamed of. See, whether Anacostia or the Sahara, it doesn't make much difference because to Whole Foods, Southeast DC is no different than the Serengeti. To them, brown-skinned little boys like my students are nothing more than walking cacti, just a piece of scenery this world has taught everyone to stay away from. Brianna literally has a landfill in her backyard, so she has a hard time convincing herself the world doesn't just think she's trash. Restaurants come and dump the remains of food she'll never be able to afford to eat 3 steps from her back door. Jose, he's fast food 5 days a week because his mother works 3 jobs to take care of 6 kids and only sees her son when she arrives home from work at the same time he's leaving for school. He has gotten so big that the excess fat bunker beneath his skin puts added pressure on his joints. His knees are literally crumbling under the weight of this world. Olivia watched her father shot 2 feet from her front porch. She wants nothing more than to go outside and play at the park after school, but gun violence has made a merry-go-round feel more like Russian roulette, so she doesn't go outside. Simply eats any processed food from the cabinet that will last long enough to prevent her from leaving the house too often. These are my students, my warriors, fighting a battle against an enemy they cannot clearly see. These kings and queens meant to feast, not to fester, but their zip code has already told them that their life expectancies are 30 years shorter than the county 7 miles away. I can see the faults of my own ancestry shaking in their eyes. Diabetes and high blood pressure run through the roots of my family tree. Heart disease is as much a part of my history as shackles and segregation. So from my father's kidney transplant to Olivia's asthma, these things are more than mere coincidence. Both grew up in places more accustomed to gunshots than gardens, so tell me place doesn't matter. Like the neighborhoods that are predominantly healthy aren't the same ones that are predominantly wealthy, because when you're not choosing between buying your medicine and your groceries, health doesn't have to be a luxury, doesn't have to be an abstract concept presented in academic journals and policy briefs. My students overcome more every day than I will in my lifetime. They are the roses that grew from the concrete, the budding oasis in the heart of the desert, and their lives are worth far much more than the things that this world has fed them.
So I would suggest to you, as I think Clint Smith does, that, we're not there. We are not where we need to be to achieve this vision that you might be imagining and the vision that I'm talking about. So what is public health? I would suggest to you that public health is about getting us there. It's about addressing the structural, the environmental, the social, the epidemiologic, the geopolitical conditions that affect, prevent, deny wellness. Public health is about the we, and I mean all the we. So we focus on populations, groups. In medical care, the individual is the patient. In public health, populations, subpopulations are the patients, if you will. And not even patients, but the client, the focus, if you will. And so we study, for example, in this case, health insurance access in rural America. We study access for populations, one piece of public health. And you'll see the core functions of public health about assurance and assessment and policy development. And part of our assessment role in public health is understanding, hey, what's going on with the people. And we do this through a variety of things. We focus on populations in a variety of ways. We work with communities to gather information or data that matter and make decisions about what we need to do, for example. We use constitutionally ascribed powers. This would be the US Constitution in the United States to change, alter the information environment. So here you see examples where what we're doing is providing people information about their own food, or reminding them that concussions can happen in the context of sports, or that you're sharing the road with cars, or that cigarettes actually do kill you. And not every message is easy to give, because the world and structures essentially will have to change in order to meet the vision of collectively assuring the conditions in which people can be healthy. Assuring systems of access to health care, assuring that people understand things, people know the dangers, people have good information. And this is hard because public health and what we can do about it is actually limited. It's grounded in our culture. So think about American culture now. The kids that are eating fast food every day, the binge drinking on campuses, the obesity, the smoking, our right to carry and have a gun. All these things are grounded in our culture, our behaviors, our values, and the tension between the individual and our civil liberties, or our construal of that, and collective responsibility. So when we think about public health, which is what we do together to assure the conditions for health, we run up against place. And place isn't just, as Clint Smith said, place is also our cultural place and where we are. We think differently, for instance, about whether and how to use these constitutionally ascribed powers to fund a variety of things, to alter socioeconomic environments, to provide for funding that will put water in communities, that will provide internship experiences or apprenticeships so that people can actually enter the workforce and get a job that in this case might have insurance that then might lead to healthier lives. We decide whether we want to put money even into lunch programs and breakfast programs in schools so that kids could actually learn instead of being hungry. Now, all these things are not total fixes, as you can see. Clint Smith's words are an indictment of what we aren't doing, right? Or our system as it exists. And so what I'm going to suggest to you is that public health is about changing structures, and that means we're going to have to think politically. Why? Frankly, because the structures are there, and there are things that we have created together, politically, socially, economically, and that these are now protecting interests. So that means change. Change in these things will not be easy. And so public health will be inherently political and is inherently political. You're going to need to understand the law. You will need to understand policy processes, politics, and you'll not need to be afraid to get engaged. So let's talk about this piece here, collective action. because you're going to have to do that too. No matter what you end up doing, whether you have a degree in public health or you have a degree from a school of public health, you are in the public health arena. You are all joining the enterprise of public health. And each piece, each thing that you do, each of your career paths contribute to the wellness of our collective societies. And so you may need to act collectively to get things done. Or perhaps you're thinking, you know what, this doesn't appeal to me. It's not relevant to me because maybe I'm an athletic trainer. Maybe, there just isn't that relevance here. So let's take a look at the example of athletic training, right? It seems pretty innocuous, pretty training oriented, pretty get those athletes back into healthy status and maybe back on the field if we can get them. Seems chilled, not too political. Maybe. So when we think about concussion, we're smack dab in the middle of a political process. And if you've ever worked in a sport, in and around a sport that has concussion as an outcome, then you know what's coming down the pike. Competing interests abound. Power structures such as schools, universities, moneyed interests that really depend upon our continuing play of the game, right? And the way we play it, right? All of that makes quite a difference in whether we can actually change the way we do athletic training and the way we do the game of football, youth football, soccer, whatever, right? And so what's the role of the future athletic trainer and their collective associations and collaboratives? I want you to answer that. I want you to be thinking about that and be prepared for that. At what point in your careers, for example, will you say that something systemic must be changed for the health of the athletes or future athletes? Perhaps you're already saying this now. So perhaps you're thinking that hey, this is fine. We should just do our jobs. We're not going to get into that political thing. We'll let the other public health people do that. Maybe the health educators, for example. But maybe you're a movement specialist and you're dealing with stroke victims or survivors. Or, as I say, athletic trainers or parks and recreation folks, and you're watching your green space get eaten up by highways. Maybe not enough funding to allow inner city kids to go out and play. Or perhaps you're thinking that leadership development actually has something to do with outdoor education and adventure education. Not sure you have a role in that crazy stuff? So perhaps it would help also if we talk about public health in terms of a parable. And I'll share with you what we also offer online, which is a parable I had done on public health. And it's a quick 1.5 minute video to describe just what public health might be. So I'm going to mute my speaker and I'll share it with you.
When we think about public health, it might be helpful to think about a story or a parable of the clinician and the epidemiologist. The Brown River flows lazily through town. It's usually lovely. One day, 2 doctors are walking along its banks ready to have lunch when, horrified, they look to the side and they see a torrent of human bodies floating down the river, some thrashing, some eyes glazed. They jump into the water to try to pull the bodies out. More bodies are coming. They can't possibly save everyone. And as one of the doctors is laying down, an older gentleman, she turns and runs up the river. Her colleague yells at her, "What are you doing? Help me save these people. I can't pull them out of the water by myself." She turns to her colleague and says, "I'm going up the river to find out why they're falling in." Now, this parable, colleagues, exemplifies the difference between public health, that which is concerned with upstream factors, prevention, understanding cause, and perhaps access to health care, clinical care, symptoms. We all want to pull the bodies out of the water, but in public health, we go upstream.
So what is public health? It's wellness, physical, mental, social, sexual, of populations and communities, and the opportunities to be well. And we address those, we do this through working on structures. We do this by focusing on not just individual behaviors. Will Beth pick a cigarette up? We want her to keep from picking a cigarette up. But really moving upstream. Well, what makes those cigarettes affordable? Are we subsidizing tobacco? Are we charging not enough tax to keep Beth from smoking? Are we allowing her to smoke wherever she wants? These are the kinds of things we want to think about when we think about public health. There are unique aspects of public health. We are inherently political. It's preventive by orientation, which is really the core message of the parable. It's grounded in social justice. If you walk away with anything from today's conversation, I want you to walk away with this. If we imagine a world where wellness is really our cultural norm, where we have a culture of wellness for everyone, we will absolutely be about social justice. Because otherwise, if we are not, we won't be able to address the conditions that will help us achieve that wellness. And we do this through, and you will see this if you haven't seen this yet, you will in your readings. We do this through core functions and 10 essential services of public health. So when you'll hear this, hey, what's public health about? Well, public health is about the conditions, addressing the conditions together, collectively, public, private, everyone, to be healthy and well. And we do this through the 3 core functions: assessment, assurance, policy development. Within that circle, you see 10 essential services. But I will tell you, back to social justice, while we believe that every community should have those 10 essential services from their public health community, not every community has that. Varying capacities of infrastructure, not just across the country, but across the world. We know now that public health is really about varying sectors and our participation in health together. So when we say public health system, it's really public health systems, public, private, nonprofit sector. Yes, it's grounded in a government function. So because of our constitutional authority, permission really, to worry about the health and wellness and safety of our population, the government, state and federal, primarily state, but federal government certainly is ubiquitous because of our funding, has that primary role. But government cannot do it alone, as I hope you see. And so that government function, whether state health departments, the 2,800 across this country, in our territories, and in Native American nations, and the national public health infrastructure that we have with the Centers for Disease Control, et cetera, and our World Health Organization and ministries of health in countries and territories across the world. They are but one part of a larger public health response puzzle. And so as you think about wellness, as you think about that world of wellness, I want you to think about what public health has to do with that. And I want you also to think about this semester, but throughout your time here at the School of Public Health. What is your part in that future world? It's more than a job. This is a mission. And so I'm going to suggest to you that the cutting edge of wellness, what we are able to achieve in this imagined world, is you. You will create together a culture of health and wellness. And you'll teach us old people what we need to be doing better or what we shouldn't have done. We want you to challenge. You will create, you will deliver, you will evaluate programs and interventions in your settings. You're going to assure health equality. You'll advocate, you will create public health policies, perhaps you'll mobilize communities, you'll be mobilized. You'll manage people and teams and organizations to promote wellness, and you may evaluate that with your community as well. No matter what your corner of the public health world will be, you're part of this enterprise. But the take home here is that public health is about changing the world. And I hope you're ready for that.